Hey guys, I am here to check in following my 2 week post-op appointment from my ruptured patella tendon. So I had my 2 week post-op appointment with the doctor. It went pretty well. She basically just took a look at my wound, and here, if you want to take a look at it, actually, it actually looks way better than what I was expecting. I was expecting, I've seen some gnarly pictures online from people who, a couple weeks post-op got a peek at their incision scar, and it was pretty nasty. But mine was very clean. It was minimal, I think, for this surgery. There was not really any blood there. So obviously I think the surgeon did a good job, and also I, tried really hard to take care of myself post-surgery, and I think that might have paid off. In terms of the appointment, it went about as well as it could. I got a referral for PT. I can start that, so I'm going to start that in a couple days here. She also told me I can, put full weight on it, still walking with the crutch. I also got instructions that within 2 weeks I should bend my knee 60 degrees. So initially, when I saw my post-operative instructions, they seemed very conservative to me. It said, absolutely no, doing any kind of exercises on the leg, other than the ankle pumps, and got to wear the brace the entire time, and no weight on it at all. I saw some post-care instructions from other surgeons, and so it kind of varies a little bit between surgeons in terms of, are they going to be more aggressive, are they going to be more conservative. But a lot of it also has to probably do with the degree of the injury. My surgeon also told me that during my surgery, when she went into my knee, it was a mess. Like, my tendon was shredded in a bunch of different ways. So it wasn't a clean tear. But I think everything turned out pretty well. She had me start trying to bend my knee for the first time after a couple weeks. It was pretty painful. She set my brace, to 60 degrees when I'm just sitting and want to, practice bending. So that's something I need to do a few times a day. I need to keep bending it, and keep encouraging the bending, try to break up some of the scar tissue. I've been able to get around a lot easier. I've been putting weight on the leg. I'm trying to ramp up, some of the activity, and trying to get stuff healing here. I'm also at the same time trying to be careful not to push it. I'm still icing several hours per day. And I'm saying that like just, knowing in the last day is when I've gotten these instructions. But even before I went to my post-op, I was still feeling better. However, I just want to make sure I'm not, going to set myself back at all. So I'm going to go to PT. I hope I can bend my leg, somewhat. I don't want to, I do know, just even doing it once at her office, so painful for the first time bending it. And I've, been bending it when I can here at home, still very painful. So when the physical therapist does it, I hope it's not going to be, crazy intense pain. And I hope I can get, a solid amount of bend in my knee, because getting to 60 degrees is pretty aggressive within, 12, 13 days. So, and then after that, within another week of that, I need to be at 90. And then a week after that, I need to be at 120. And then after that, there's no restriction on range of motion. So that's within a month that I should have no restriction of range of motion. I'll probably be in my leg brace another 3 to 4 weeks, it sounds like. And then I'm hoping, to start walking around without crutches, at least just around the house, just to try to strengthen my leg within, a couple days here. But I'm excited. I'm trying to get back to the gym next week. So my spirits are high. I just, I'm preparing also for the possibility of setbacks, on a day-to-day basis. So we'll see what happens. But overall, I'm just really excited to be able to start PT. And I'm gonna, like I said, keep eating the right way, keep eating, organic fruits, vegetables, keep taking my supplements, my turmeric and ginger and, supplements along those lines, olive leaf extract, zinc. Just try to keep these good nutrients flowing through my body so I can keep, recovering more and more. Other than that, I will check back in after my PT session and let you know what's going on. Thanks.